not just isolated places. For example, in Roanoke, resettlement go as far as Blacksburg. In Newport News, we have resettlement up to Virginia Beach. And Charlottesville is not isolated within the area of Charlottesville. Neighboring communities like Farmville, we also put refugees in there. So what I'm saying is that these are where the centers are, but they are also relocating refugees to neighboring areas. So on the local refugee resettlement, they provide direct care and support. So when refugee comes, the local refugee resettlement take care of them, meeting them at the airport, bringing them to their temporary housing, enrolling them, kids enrolled in schools and adults enrolled in ESL, especially if they are not English proficient. So we rely so much on refugee resettlement. And I know some of them are your partners. So we have a good time talking about refugees here, but soon we will be talking about um, the immigrants as well. But refugees, just to make a differentiation, are simply special immigrants because when they come, they receive government support. Unlike other immigrants, they don't. So refugees is part of my work. Here, let's talk about immigrants in Virginia. Immigrants, as defined by the USCIS, is any person lawfully in the United States who is not a US citizen, a US national, or a person admitted under a non-immigrant category. So, in as much as there is a wide array of immigrant classification or categories, I am not going to talk about each one, but rather just to show how the landscape of Virginia has changed with almost 87% increase from 1980 to 2018, or for a period of close to 40 years. 87%. That's very, very high. As of 2018, an estimated 1,065,000 are foreign-born um, residents, representing approximately 12.5% of our country's of our Commonwealth's total population. Just to put it in context, in Virginia, 1 in 8 are foreign-born. Of these, two-thirds live in Northern Virginia. One significant information I want to highlight is that foreign-born Virginians are not differentiated by skin color, by race, or ability to communicate effectively in English. As you can see here, 39% or um, over 1 million are foreign-born and citizens, while others are followed by Asians are almost 35%. Black, composed of about 12%, taking whites and Asians combined, it's almost three-quarters or over 750,000 individuals. These numbers are reflected here in this graph, in here, okay, right here in this lower portion. It's small, but it's not about the graph. What I'd like to emphasize is showing you that the color, the deeper the blue, that means the more dense the immigrant and refugee population are. So these numbers are reflected in this graph, which shows you that Northern Virginia, Richmond, and Hampton Roads have the higher density of foreign-born population. This came from this map came from the Joint Legislative and Audit Review Commission, or the JLARC, which is part of our legislative system. So why is it essential for me to talk about refugees and immigrants? It is for two very important reasons. One, that within this population of refugees and immigrants are individuals who are limited English proficient, or LEPs, and they need interpretation support to access health, mental health, social services, and other needs. The second reason is, is the opposite of the first, because in that same population, some of them are highly educated individuals who are proficient in English and, of course, their native language. Generally, we call them bilinguals. And we can train these bilingual individuals to provide culturally and linguistically appropriate services. By bilingual, we mean that they are really proficient, not just able to speak a little bit of English. They are really proficient in English and, of course, their native language. And so they are able to communicate well with service providers or probably um, our counselors or even people who are serving them, like direct service workers, such as uh, frontline staff, case managers, and things like that. And so, with that, effective communication is very, very important because if we don't start it right, all the other chain of communication that follow is not right, correct? Until someone discovered that it's not right, and then we start over again. But what a waste of human resources and economic resources that had been wasted, all because we did not start correctly at the very beginning. So let's define what limited English proficiency means. Actually, this is a definition from the legal aspect from the Office of Civil Rights and the Office of the Department of Justice. So, what is a limited English proficient person? This is an individual who do not speak, who do not read, who do not write, or understand English as considered by law. So it doesn't have to be all four. Just one facet of effective communication can render the individual to be considered LEP or limited English proficient. So as defined under Executive Order 13166, and this was presidential um, executive order signed by President Clinton, then President Clinton, this was reflected in the succeeding guidelines that came after that. And so we have the, the the support to the general framework of the Title VI of Civil Rights Act of 1964, and that when we talk of limited English proficient individuals, they should be served with language access support. One, it's their right, and two, that is the right way to do it. It actually saves funding and it saves money. Let's talk about here. I have a case analysis and I'd like you to participate. Um, let's get ready your keyboard and your phone. Let's have your answer in the chat. And the question is answerable by yes or no. And here it goes. I'll read it so everyone can follow. Regina, which is not her real name, is seeking for social service support. She speaks English and considers herself bilingual. However, growing up from a non-English speaking country, she has a very thick accent. The frontline staff and the case manager who are helping her have difficulty understanding uh, what message she is trying to convey. So Regina also have difficulty understanding the attending personnel who speak English only. So my question is this: is the organization obliged to provide Regina with interpretation services? Regina claims that she is bilingual. However, there is difficulty in the communication, you know. So let's give you 30 seconds to reread the question and place your answer in the chat. Just answer yes or no. Does Regina or does the organization is obliged to provide Regina with interpretation services? Okay, thank you. Response are coming out in our chat. Yes, 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 yes. No, I think we can assume that this is a yes question, right? The answer is yes. Yes. Uh, I got this case from Federal Register 65 552 762. Those are just, I just want to let you know that these are not make up stories. These came from a legal document. So According to these, the answer is yes, because language and accents are identifying characteristics of language and national origin. If the organization does not provide language access to Regina, then it could be considered as a pretext to international national origin discrimination. Awesome, we got this right. Thank you so much for participating. So the next two slides that I will share with you is about the issue of friends, family, or minor children. Okay, so the first slide is about we call it family members or ad hoc or non-formal, whatever they call it. But let's write, let's get ready again for the chat. I'd like to engage you. Here's the question. Actually, I seem to have two questions. Okay. The answer here is what could be the consequence to the patient? Okay. So we have two questions. And I'd like to know if you can share what is your idea about the consequence of these to the patient. So first is about a woman who is brought to the emergency room of a hospital by her brother. The hospital has no language assistance services and requires her brother to interpret for her. She is too embarrassed to discuss her condition through her brother and leaves without treatment. So that's the case of a woman. The second is about a health clinic uses a Spanish speaking security guard who has no training in interpreting and is unfamiliar with medical technology, but he speaks really good Spanish for this Hispanic speaking patient. This security guard frequently relays inaccurate information that results in inaccurate instruction to patients. So, my question again, what could be the consequence to the patients, be it this woman or this this person who is with a security guard who is interpreting? Let's take about 30 seconds again to see what your response would be. What could be the consequence to the patient? Put it in our chat. Thank you. We have our first response. Both of these are like HIPAA violations. There is a patient right to confidentiality, and the patient does not have the accurate information needed. HIPAA, it's a question of HIPAA, but HIPAA, breach of confidentiality. There's one here on the screen that says they did not get the service they came for. Instead, they went back with probably worse condition. Okay, we got that. Mostly HIPAA and breach of confidentiality. Yes, former ERICU nurse here. Yes, we're glad to have you, Miss Nurse. We always ask the patient for verbal confirmation if they were okay with a family member as a translator in a private environment without a family member present. And the individual, according to one person, the individual will not get good service. Thank you so much for this participation again. It gives us really an insight how the services of interpreters and qualified interpreters at that is important to service and without violation of their rights. Thank you so much. I think we're getting on track here. Let me go to the next slide. We talk about interpreter competency. And with this, the legal document define competency as being able to, that the person is proficient in both English and the target language being the language of the client or the individual, and the person receive orientation and training, that is the interpreter, that includes skills and ethics of interpreting. And that in these ethics of interpreting, the issues of confidentiality, accuracy, and respect are being emphasized. So the legal document under our Federal Register 65 and 67, it says that competency does not necessarily mean formal certification as an interpreter. Although certification is helpful, what we need are trained interpreters who are proficient and has been tested to be proficient in both English and the target language, and they are they are taught during the training about confidentiality, accuracy, and respect. Let me share a little bit about what this means. In interpreting, if I am bilingual, which I am, if I talk to you, I'm expressing to you what is in my head. I'm telling you what I feel, what I think, what I believe. And that's me expressed in a different language, not English, correct? That talks to me as a bilingual person. However, to be an interpreter, I should be able to listen to this other person's feelings, ideas, or concepts and message, thought about it, process it in my head, and then say it in another language what this person thoughts and ideas and feelings are all about. So the skill is different. Just being bilingual, I can talk to you about my own feelings, my own message. But to be an interpreter, we are talking about another person's message, another person's feelings, another person's idea or concept. And so that skill of transfer from this person to mine and articulating it verbally is a skill that is needed and has to be trained. And if you gain kind of blend those skills with you, you can be called competent. Okay. Now, confidentiality, I don't think I need to talk much about it. Confidentiality is HIPAA. And we have seen that many of you already knows about that. Confidential. Do not share it unless it is necessary or within the team or within what is defined and what is permissible under HIPAA. Accuracy. Accuracy involves consideration of culture. How I say my words may not have direct English translation, right? And how I say my word may be um, culturally based. And so if I don't understand it and I don't consider the impact of culture in the way I speak, then we might not be accurate, because accuracy means you deliver the message, not the word. It's the message, not the word. Because if there is no word that is equivalent to the message, then we lose the essence if we are interpreting word for word. That's why we talk about accuracy, which is delivery of accurate message. Okay? I hope that is very clear. Respect is another one, and this is um, very related to having a family member interpreting for the individual or the client. What is it that we talk about respect? Like that first story of a woman, she cannot articulate what's in her mind, what's in her heart, what is her real condition, because the brother is interpreting, or the brother might be present. And so sometimes it's the other way around, where the brother or the husband, probably, who will be interpreting, make the decision for the individual. And so the respect in terms of what the individual want, what the individual uh, expect to say, is not transmitted, or in some way is not just being curtailed or not transmitted, but rather the other person who is also the interpreter does the decision for and in behalf of the client, with or without the person knowing it. So there's a big difference of having a, a family member that the patient or the individual trusts, but there also a little bit of conflict, if I may say, because sometimes when the other person makes the decision for the in behalf of the interpreter, then the message given to the person, such as, let's say, the provider or the case manager or the person in the front row who is doing the history, may be different, right? If I am not free to say what I want because of the interpreter, then I'm withholding information, which could be very, very important on how the case or how the illness would be treated. Correct? So, as much as possible, if you are a provider, have a different person. If this person says, "I want my daughter to interpret for me," the law respects that. So the daughter can be the interpreter for the patient. But as a provider or as a case manager, you got to equip yourself with a real competent interpreter, be it a volunteer. Someone is there to ensure that this person is giving you the right information. Okay, and that we can provide in a training. So let me go back. No, not go back, but let's proceed to the last one. Let's see, number two. Okay, let me finish this competency. This number three, we talk about knowledge in both languages. The other word is specialized terms. When we talk of medical interpreting, there are specialized terms. And let's say a child, maybe 7 year old, maybe 12 years old, may not have never heard what those terms are. And sometimes when they talk about private parts or something that will hurt the client, usually if they are family members, they will tone it down or replace it with something else. And so the accuracy of how the information is conveyed is not accurate. And so the use of specialized term is important, and usually this is given into training. In behavioral health, which is where I am very much familiar with, there are so many specialized terms which training is essential. We don't expect you to know all the specialized terms, but at least be familiar with it. Let's say PTSD. PTSD, if you don't understand that, you just thought it's one of the acronyms like BRHP. BRHP is a program. PTSD is a very deep sickness, right? It's a mental health issue. But if the interpreter, such as a 12-year-old child, may be talking about PTSD and is not able to relate that because she downplayed what PTSD does not mean, so we are having right at the beginning an incomplete and maybe inaccurate assessment at the very start. If this is case management, it already tells you that the resulting action of that case manager may not be very accurate or appropriate because she missed some of the valuable information. Okay, then let's talk about sensitivity to the person's culture, which I mentioned. You can take the person out of a culture, but you cannot take the culture out of a person. The way I speak is influenced by my culture, how we frame our sentence. Although I use English words, but the syntax, the way I frame my sentence, the way I ask my questions, the way I present the message is different because I'm not a native English speaker. I'm ESL like you. English is a second language for me, although I have a privilege to speak English proficiently. But it doesn't mean that I may not I may not have issues in other ways because as ESL, sometimes we just cannot pull what exactly is that word in English. I know what I mean, I just cannot say it. And telling you, any bilingual person will encounter that kind of challenge. We try to be as proficient and as flawless as we can, but when you're talking about a message translated a different language, that's another, there's more challenge to it than just using the words. Tone could be an issue, right? It could be how we how we frame it, that the word really doesn't have equivalent words. So how will you go around to present the message? These are things that we need to do during the training. And so I'm going to almost the last slide here. And I'd like to have another, oh, let's not have a poll. Let's have a chat again. I'd like to know, what do you perceive as barriers of having competent volunteer interpreters? Not the professional interpreters, but volunteer interpreters. Question again, what do you perceive as barriers to having competent volunteer interpreters? I'd like you to put it in the chat again so that we all have a bigger view, that it's not just your organization who is struggling or having this issue, probably many of us, and we can address this as a big group, right? So you don't feel alone. Let's try. What's in our chat? Okay, Dilshad said awareness and training. Kilsi said recruiting competent folks. Sabrina said training. Bonnie said recruitment and training. It's just flicking because a lot are coming in, but I hope I can read it and you can read it as well. Teresa said assessment guides, and Catherine said time, volunteers. Carla said accurate training, cultural difference, and literal language. Emily's talk about training. Veronica talked about emotional engagement with the client. Leicester talks about not enough people familiar with people's culture. I think as these are coming out here in the chat, these are not isolated issues, correct? Would you agree? We all have this. And guess what? I am here to share with you that in the training part, in the cultural part, and in solving some of these barriers, I can help you. Not I as a person, but my program, the Virginia Refugee Healing Partnership, can be of help. And this is how. How can we help you? The Virginia Refugee Healing Partnership, we develop our own curriculum. So you don't have to pay $200 just to buy a textbook. Ours is a little cheaper with a manual, a workbook, and a glossary. Remember, vocabulary is important. So the glossary, which is a little bit smaller, handy, and you can put it in your car and study it if you are a real good interpreter and want to be a good interpreter. So we have this training, and our training is both in clinical and in educational settings. We have two separate curriculums, but they all have three different levels. Let's first talk about the basic 8-hour training. Well, thank you so much with your responses in the chat. Okay, so let's talk about this. The first one, the basic 8-hour course, is a course called Interpreting Course for Laypersons. Generally, we just say CLP. This is especially designed for high school students who are helping their family members as well as their neighbors and friends. This CLP is also designed for volunteers, be it young or not so young, but are helping as volunteers who gave their all to help others. Whether they know them or not, these volunteers gave their all. This CLP, or the 8-hour interpreting course, is offered by request. So we can have a group of 10, of 15, or probably 20, and we can set this up as an online or as an in-person training. Now that we are allowed, we are no longer as restricted in terms of COVID. So we can offer these in person or um, online. Okay, but we need your help. You find your volunteers. If we do it online, then maybe four can come from Roanoke, three from Newport News, two from Richmond, one in Fredericksburg. In short, I'm saying that in an online process, we can gather people from across the Commonwealth. In person, we got to be just within your area or within your organization and different neighboring areas, because it's also hard to attend an 8-hour training from Roanoke to Newport News or from Blacksburg to Newport News or the other way around. Um, Northern Virginia volunteers would find it hard to go to Blacksburg just to attend an 8-hour training. But if you want and you can have your own group of 10 to 20, we can bring it to your area in person. The three others, we have the beginners, which is 32 hours, the professional, which is 48 hours, and bridge, which is 32 hours. These are online training, and the schedule is now posted at Eventbrite. This is year round. Every month we have a training, and it has very specific course for clinical setting, which means if you want to volunteer, not as a volunteer, but if you want to interpret and get trained as a professional interpreter or as a bilingual staff interpreter, these are the courses for you. Okay, so we have courses for volunteers. We do have courses for bilingual staff, which is 32 hours. We have behavioral health professional interpreters, which is 48 hours. And the bridge, which is if you know somebody who is already an interpreter and want to specialize in behavioral health, this is the bridge program. It's focused really on concepts because they already know the skills. We cut it off because 32 hours is enough for them to understand what the behavioral health field is. The reason why we train behavioral health as a specialized field, it's because when you are when you're a mental health interpreter trained in mental health, you don't know behavioral health terms. And what we have experienced is that many medical interpreters are traumatized after they serve in behavioral health because they were not trained to do so. They were not taught about domestic violence, about rape, about PTSD, about serious mental illness, about delusion, how to deal with those. So, in short, they were interpreting, they tried their best, but in the end, some of them may not be able to cope and they are traumatized themselves. We want to avoid that, and so we offer them the behavioral health interpreter training. And so they can serve in the clinical part, which could be the CSBs or any of the behavioral health facilities across the Commonwealth. But also, we have one special curriculum for interpreting in educational setting. The difference is when you interpret in educational setting, you're not talking to one person. You are sitting across the table with probably 8 persons to interpret, which we call group interpreting. And the mechanics is different. So we have a specialized training for that as well. And talking about school setting, we talk to parents, but the real issue is about the kids. And so interpreters need to understand the developmental stages to properly relay information to parents because this talks about the kids, but guess who are listening? The parents. So it has to be done in the pretext of understanding the developmental stage of the child being discussed. So much about the real, the interpreting who are non-volunteers, but I'm just telling you that if you like being a volunteer interpreting and you want to advance, there are other trainings available to you for free. The Virginia Refugee Healing Partnership, in collaboration with the Office of Behavioral Health Wellness and the Office of New Americans, are bringing these to you for free. So please take advantage. And then we're just about very close to the end. And here we go. Okay, one last in the chat. I'd like you to take action, but let me know how, because from your response, it will give me some ideas how to make a strategic plan on strengthening the volunteer training. So kindly help me out in here. In the chat, please answer. How can your organization get your volunteers to be trained as interpreters? Again, in the chat, please provide answer. How can your organization get your volunteers to be trained as interpreters? Okay, we'll take another minute. Get your response. Okay, Debbie, I will answer your question shortly, okay, with the panel. So, do I have response for how your organization can get volunteers to be trained as interpreters? Thank you, Veronica. We need a recruitment plan and a job description. Sabrina said we provide free training, which we do. Awesome. We suggest interpretation services. Okay, thank you, Carla. Also, interpreter, INSP, let's give them time to take the training. Okay, thank you. Denisha said, let's share training info via newsletter and social media. Okay, how else would you engage? Let's see 2 or 3 more, 30 seconds. Give you time to complete your response and send it our way. Okay, Lay Sister said, first, volunteers need to be recruited who already have good understanding of the language. Then you can give those individuals further training. Correct, very good. We do not train language. You got to have those language proficiency with you. Although we do screen language proficiency, that's on us. We pay to get the language screening if you take one of those higher level. But for volunteers, we don't need that. We just rely on you. Taking courses according to Sol, taking courses and offer the opportunity to volunteers. Offer training through your site. Okay, thank you so much. These are very good. I will gather those and that will help me in creating a really a strategic program on how we can strengthen CLP or interpreting courses for laypersons, which focuses on high school students and volunteers. So thank you so much. Here is my contact information. You can email me through vrhp@dpsdh.virginia, spelled out, .gov, or you can get my phone number, 804-837-3808. Okay, and may I ask Alex, would they be able to get this PowerPoint? Would you be able to share it with them along with the handouts and other info that we will share?
Yep, everyone who registered and everyone who's attending will get a follow-up email with the PowerPoint, the handouts, any links you want to send along with that. And yeah, so all the resources and your contact information will get out to everyone after this meeting.
Okay, there you go. So I'm not far away. I'm just an email away. And if you have, I cannot guarantee that I will respond to calls immediately, but if you do, please leave your message and I will definitely, I can promise you I'll call back. But if you email me, I'm not so far away. Thank you so much for sharing your time with us. And I will turn it over to Alex.
Thank you so much, Dr. Stitt. That was a really, really informative presentation. And there's just so much valuable information and so many good opportunities that you're providing through your office. And so I'm really glad for this opportunity to get the word out about that to so many people who are attending today. We're now going to move into a panel conversation. So the way we'll do this, I'm going to welcome Jan Hawkins and Lynn Lauritsen from Volunteer Prince William and the PATH Volunteer Hub to join this panel here. I'd ask everyone to go ahead, put questions in the chat, and they'll do their best to moderate, answer questions, have conversation, and share experiences as we go along. You've all done a great job engaging so far, and so let's keep that up. All right.
Yeah, so I really appreciate it. So let's engage some more.
More engagement. That's our goal with these seminars, is for everyone to be able to share their experiences. So Jan Hawkins has been with Volunteer Prince William since July 2016, first as the director of the Retired and Senior Volunteer Program, and currently as their program director. Prior to joining Volunteer Prince William, Jan spent over 13 years with Northern Virginia Family Service as the volunteer coordinator for the SERVE campus in Manassas. At SERVE, Jan supervised a volunteer program of several hundred individuals and groups. She also recruited and supervised volunteers in support of events, drives, and fundraisers. Lynn Lauritsen is the manager of the PATH Volunteer Hub located in Fauquier County, Virginia. Lynn's background is in overall operational and human resource management and transitioned into volunteer management in 2006 when she was hired as Director of Volunteer Services at Fauquier Hospital, where she served for 10 years. In 2016, she was hired by a local community foundation to start a volunteer center to serve the community. Lynn currently works alongside the Center for Nonprofit Excellence in another PATH Foundation community program, Community Link, in a local resource center. The PATH Resource Center is designed to connect the community with information and services through volunteer opportunities, local resources, and capacity building support for nonprofit organizations. Please welcome both of them. And I'm going to go ahead and mute myself now and let everyone have this wonderful panel conversation.
Well, good morning, everyone. Actually, I just want to start out while everyone's kind of thinking about maybe some questions they might have, just to give a little context to kind of how we arrived here today. Jan and I, Alex had approached us and had put out, quite a few different topics that we could look at. And I know this resonated with both of us because I think, and I'll let Jan speak for herself, but I know that in the last year, I have been working rather intently with, trying to resolve some or remedy some challenges that we've had in our community with interpretation services. And for instance, our local free clinic, uses them all the time. And actually last year had spent more money, on just using phone services because they didn't have the resource available on hand. And we're trying to kind of transition over into an on-site and volunteer interpreter resource. Also, Yesenia Reyes, who's actually on the call with us on the workshop today with us, works on our Community Link call center. We are very fortunate to have her. She is bilingual. But as a result of her in this role for many years, providing connection services to what many services that the nonprofits provide in our community, she has also noticed a great need for interpretation services that she has tried very hard to provide herself, but immediately realized that she needed support and help. So she actually is working on creating kind of a cadre of volunteers in our community that can provide kind of on-call interpretation services. So this was very timely and very relevant for us. And I have to admit, I've learned a lot. I kind of felt like interpretation services was just that, okay, somebody that knows the language can interpret what's being said. But after listening to Eva, and also speaking to our local free clinic and Yesenia, I realized there is so much more to it than that. And certainly training is so important. And I was thrilled to see that there is free training available. And I just, if that's at least one thing we all walk away with today, it would be a win, because certainly in looking at the responses in the chat, that was something that everybody indicated was a barrier, was not having access to training. So appreciate being here today.
And thank you all for attending this today. I too have from my last nonprofit encountered the situation where a client would come in, did not speak any English, and I don't speak anything but English, and it made for very awkward, uncomfortable situation where I felt like I wasn't properly serving that client because I didn't speak their language. So this has been very, very helpful. And I really do appreciate Eva coming in and doing this presentation. And like Lynn, I too have learned a lot from this. And I actually have a program here at Volunteer Prince William that deals with alternative community service. And we will sometimes have a client come in again, that does not speak any English. And our staff member was very excited who deals with the program, was very excited to learn that this program is in place. So she's definitely going to listen to the rebroadcast and see if we can get her to take some of the training and refer a volunteer to that as well. So thank you, Eva, for being here, and we appreciate your presentation.
So we'd
So-
like to, oh, go ahead.
Go ahead, Lynn. I'm sorry.
Oh, no, I was just going to say, of course, we'd like to invite everyone to submit any questions or discussion topics that they'd like to include. I do notice Teresa had mentioned my organization has providers, nurses, and admin staff that need language screening for Spanish. Any suggestions?
If you just need language screening, which I mean, I would understand language proficiency. If they are from Virginia, we can facilitate screening in English and their foreign language for free. We pay, which means we're using government funds. That's not we as personally. We're not that rich, but we have government funds allocated to screen language proficiency, if that's all what she needs. Yeah, all you have to do is send me an email and send me their name and email, and I can link them to a language testing company.
And I'm going to back up into the chat to Debbie's question. She had asked, how much is the training for the clinical setting? Would you recommend all the courses or certain courses? Our clinic has a mental health, primary care, and dental clinic in one building.
That is awesome. And thank you for spotting it. I keep looking for it. And thank you, John. I promised Debbie, I catch that in glimpse, but now we are in better situation. The training is free. And would you recommend all courses? The courses are designed to your needs. If you are a front desk clerk, or sometimes we call bilingual staff, you don't need to take the big training. You can take the bilingual staff training, which is 2 hours, and that will equip you to be competent and trained and qualified to support language access for people in your agency or in your organization. But yes, if you do have much time and wants to be professional, please do come. We have that in place too. All you have to do, if you have your computer right now, search for Google VRHP Eventbrite. If you just put Eventbrite, it will give you thousands others. But if you put VRHP Eventbrite, it will lead you to our webpage and has list of all the offerings we have. I just said and mentioned about interpreter training. We do have community mental health awareness training. We do have facilitators training. We provide other trainings. So there's a lot in that web page. Just if you are in your computer right now, put in VRHP Eventbrite and you can see it there. And I really would like to see some of your staff, Debbie, to come and join us in our training. And they can pre-register. Right now we have online registration for the October training, which is in clinical setting. And if the training you want is in February, there is a pre-registration. The reason that you can pre-register is that when I post it online, I will remind you that, hey, this training that you're interested in is now being offered. Please register. That's the beauty of having a pre-registration.
Okay, and it looks like Emily has asked, is there any type of free language line that I could conference in for calls? I run a nonprofit rides program and get lots of calls from people that don't speak English, and I don't have a language line. I don't have a need for a face-to-face interpretation. I just need a way to conference in an interpreter for a variety of languages for brief phone calls, less than 10 minutes.
I missed my friend here, but if you know of, I kind of made aware that there were 3, but if you know of anyone, please share it in the chat.
Yeah, I mean, I know there's, because I'm assuming you're referring to a free service, right, Emily? Because,
Yes,
I mean,
yes.
there are paid, but it's expensive, yeah.
I know I have my trained interpreters here. If you remember what our colleagues have shared during the training, please put it in the chat. Otherwise, I'll dig my notes. I know it's there, and I will share it with Alex to be shared to everyone.
Okay, and then I don't think we've gotten to this question yet from Nasira. She is asking, I am looking for resources for sign language interpretation. Any suggestions?
Sign language is very, very, how would I say this? They have a very, very strict guideline. You just cannot get an 8-hour course and make you a sign language interpreter. They have very strict guidelines. Like, for example, you cannot be a sign language interpreter unless you have a bachelor's degree, or at least taken at least from what I know is um, associate degree. So uh, I'm I will put in chat. I'm not sure, but we have a state coordinator for people who are deaf, blind, hard of hearing, and I guess you are referring to your clients who are in this category. I'll put in the chat. Um, Her name is Kathy Baker. Let's see. Okay. She is our state coordinator. I'm I'm not really, I cannot speak for her, but you can email her and ask if she can help you out. ASL is entirely a separate field.
Okay, if we're ready for the next question. So Carla asks, hello, my name is Carla Jarvis, and I'm the new community educator and volunteer coordinator at Abuse Alternatives in Bristol, Tennessee. We specialize in domestic violence intervention services. I'm bilingual and have gone through federal court interpretation training. Is this similar?
There's a huge difference. Uh, Court interpreting is very, very strict. Culture is not even included in there. You just say what the judge say. Yeah, and of course there is, the protocol is different. Like in our field, like medical or behavioral health, you can raise your hand and say, may I clarify? You cannot do that to a judge.
I actually have a question, Eva. Coming kind of from a quality risk background. So you talked about a lot of the you know, all of the different types of nuances in the training in terms of, you know, how you interpret, and that it isn't literal, but you don't impart your own opinions and so forth. So there's a lot of things that are important to know to use as volunteer trainers. So once you've done that, so once these, if any of these folks avail themselves to the training that you provide, can you make recommendations on any sort of quality assurance follow-up in terms of, once you have a trained volunteer, how then can you ensure that it's being done well, and that there isn't, that these oversights aren't occurring, or that these types of practices are not happening? Because certainly, you have an interpreter who knows the language, and you're relying on them to do what they're told. How, what practices can you have to follow up and ensure that you're providing things in an appropriate way according to the training?
Thank you so much, Lynn. If we talk about volunteer interpreters, even our own interpreters, there are 2 survey questions after the training, and this we do on the spot. It's random. One, You can ask the person they had been interpreting, how was the interpreting? Just let us go, let's say 1 to 5. How happy are you with the interpreting? Right? So they say 4. Okay. Then for you as an organization, you need to delve deeper and say, how was the interpreting? In what way can we improve? And in what way, how can we help clients with those kind of situations? So it's a little bit more for you because I'm out of the league. It's between you and your interpreter. So the best person to do quality control is really you, the receiving organization, receiving of the language access services. I hope, would that be helpful?
Yeah, do you have these surveys, I mean, obviously they can use their interpreters to create these surveys in the language, the intended language, but do you have any samples of surveys that can be used for these organizations? Or like you said, is it just those two
It's
questions?
just very practical. It suits whatever. I would say that align it with your mission.
Mhm.
3 simple questions. And more than that, it's no longer, probably it's no longer practical. Think of things that will strengthen you, that will support your mission and help your volunteers. If you heard them always say, I'm stumped by so many words, that means they need vocabulary building.
Mhm.
Let me know and I will offer you a vocabulary building class.
Mhm.
Things like that. But it has to be aligned with your mission, because we are not having interpreters because they just interpret. We're doing this in support of what our organization's mission and vision is. And it's different for every organization.
Mhm. Right. So I think it's important to note that just like any program that you start, it's important to have, quality measures to ensure that it's being done well, and that you're delivering it in a way that is responsible and appropriate. And so, another element of a good interpreter program is the follow up, I guess, and
Of
surveying the
course,
recipients. Mhm.
of course.
I'm not seeing any new questions in the chat. Lynn, are you seeing anything?
Oh, just one popped
Oh,
up.
yay. Okay, so Carla has asked, do you offer cultural interpretation? As you referred to federal court interpretation being very different, would you recommend taking cultural interpretation if offered or available?
Um, I'm not really, I'm not really, how would I say this? I do not know about cultural interpretation, but in our program, especially in behavioral health, and when we developed that program, half of those reviewers and participants are clinicians. That's why we were guided that culture is an important component of behavioral health interpreting, because unlike medical, where you have blood works and CT scan and X-ray, it those those uh, those will exactly tell you, oh, there is a break in this bone, or there is a, you know, in short, in medical, you can see everything, almost everything. In behavioral health, there's nothing. If we say this person is suspected to have PTSD, what shall we do? Do we have a CT scan to show where PTSD is? If we say emotional disorder, do we have an X-ray to show where the emotional disorder is? There is none. And so the basis is basically language. And mind you, the treatment is also language. It's all about conversation. That's why it's very, very important that in behavioral health, we look into the cultural component big time. So, in just to make a straight answer, in our training in behavioral health interpreting, culture is an important component. There's one chapter dedicated to culture, and most conversation, if not all of the conversation, leads you or related to culture. The second part is We also offer cultural competence training. Okay, it's not related to interpreting, but this is more of staff understanding cultural competence. For example, um, bias. Although we say, I'm never biased, I have all this training in bias, but you can never, never say you don't have bias because you do. Bias is how we interpret what stimulus gets into the five senses. Just the way I see things is already biased. You know why? I interpret it based on my culture. I interpret it based on my own learning. So if I am a psychologist, I will definitely interpret what I see differently from a social worker, from a police, from a doctor. And so if you say you're never biased, that's you got to re-examine yourself because we do. The way we feel, why did you feel it that it's a simple picture, but the way you feel and the way I feel will be different because all these stimulus are interpreted based on our experience, and culture is a big component of that. We provide meaning based on what we learn, and basically at the very, very basic, the lowest part that usually triggered autonomic response is culture. I hope that, so in short, just to wrap it up, in interpreting, we include culture, but also for for personnel, frontline staff, providers, executives, if agency executives, if they want to, we offer simple 8 to 16 hour cultural competence training.
I like how Maria wrote, continued education is another way to make sure your interpreter is doing a good job. That makes a lot of sense. Eva, do you all offer any ongoing type of education that differs from the, initial training that occurs for interpreters?
Oh, of course.
Mhm.
We have an annual language access for oral interpreters. And I intentionally use the word oral interpreters because in the early years, we were talking about interpreters and we have ASL interpreters. Some of the principles that we use are not applicable to them. And so we have annual conference for oral interpreters, and this is online. It's attended by many Virginians, also from interpreters from other states and even interpreters from other countries. So we don't leave you behind. After we train you, we just don't say go and multiply. No, we say come back and learn some more. We have a continuing education program that will support interpreters. So other than the conference, we have at least 6 webinars specific to language and interpretation. And put this in your calendar, September 9th, 1 p.m. to 2:30 p.m. We have interpreting for individuals with autism spectrum disorders, September 9th. And there is one on trauma on October, and there is another one in November. We have January, February, March, 8, so 3 webinars at the beginning of the year, and then we have the conference in April, and then usually we start in July, August, or September, and this year we were late, so we start September, October, November. So at least 6 webinars specific to interpreting. If you train with us or even you did not train with us, please join us. It's online and it's free and it's fun. I'm telling you, our presenters are fun because they are down to earth. They are practitioners. They are not theorists. They don't talk about engagements that are bent on what they pulled from research and books. These are real interpreters, these are real lecturers. Even if they are, let's say, professors, they are practitioners. So they are not just talking about what they read in a book or probably as a result of their research. They are talking about real life experience, that which is practical, that which work. Those are best practices in the industry and many things that would help us. We even have um, we even have in many of our trainings, we have people who are coaching others to establish to become entrepreneurs. Establish your own program. Interpreting is a $50 billion industry. I don't ask you to earn 1 billion. I just ask you to earn enough for yourself and help yourself. Because with online interpreting, hey, it's almost 24 hours. You can, I mean, you can do your 8 hour job. Please don't leave your 8 hour job. But you can do interpreting as a sideline, be it in California, be it in other parts of the United States, even in Canada. Yes, if you talk to language service providers, because of COVID, we have expanded our online services and online infrastructure that it's just easy to connect because of online services. But of course, you got to be good with technology as well. But sometimes when we were preparing our session this morning, there were like lapses. Sometimes, sometimes technology doesn't cooperate. That's part of the challenge. So you got to have your plan A, plan B, plan C if you are a telehealth interpreter, right? So that's part of everybody's job. Just be proficient with whatever technology that is in front of you. You should know how to troubleshoot so that in case there are issues, you just don't close shop because there are issues. Find another way, right? Because remember, they depend on you. They depend on you. If not because of you, their conversation will not be meaningful. The treatment will not be effective. So, this is what I tell interpreters. When you are interpreting, focus on the then and now and how to do your best. But also think that after you're interpreting, the life of that person is impacted by the way you serve. What what the case manager will decide, what the doctor will decide, what the provider will do, depend on your words. And so you impact the lives of people. You're not just serving for 1 hour or 20 minutes. You are talking about the life of a person. So think about their well-being. Your work is important. Because of you, they have achieved what is best at that moment in time, which will continue their lives after you have served.
Okay, we have what I think is a really good question from Kelsey. She is asking, what recommendations do you have for recruiting volunteer interpreters?
Yes, let's start from the ground. Interpreting uses a ground up model. Interpreting cannot happen with me making programs and putting it down. So it's a ground up approach, which means that we need to market. First, we need to educate the community how important it is to help with language access. Two, those who have the skills should be trained so that the work that they do is within the context of what is expected of them and in compliance to legal standards, such as confidentiality for that matter. That has a legal basis. Accuracy has a legal basis. So, so let's do it from the ground. Work with our communities. Let's first educate them because all these programs that we do has no meaning. Correct, John, Lynn? It has no meaning until the people understand what it is. For then, they have their own resolve, they are motivated, they are committed because they understood what the program is and what benefit they can get. Maybe it's not personal. I'm doing this for my family. That's a very strong motivation. I'm not doing this, but my grandma needs it. That's a very strong motivation. So before we talk about having good interpreters, let's first make a big conversation at the community level, the importance of language access and how people benefit from it, and how people can how we can impact the lives of those who really become our clients, who come to our doors. All we have, and the only big barrier is language. Barrier that we can solve. We can hire professional interpreters. There's no problem if you have money. But for our session, we're talking about volunteer interpreters. There is also the word we call dual role interpreters, staff who are bilingual, right? Staff who are bilingual. We can train them. So whether we like it or not, they're helping anyway. Let's be practical about it and put it out in the open. If they are bilingual, whether they like it or not, they're called. Oh, I know you speak Spanish. There is a Spanish client, you need to talk. Correct? Whether we like it or not, trained or untrained, they are there, they're helping. But what beautiful part it will be if our bilingual staff are also trained. So they have the parameter, they understand the ethics of interpreting, they understand the standards expected of interpreters. And by doing so, they are helping you saving cost, not just in terms of how much they have helped clients, but also there is cost to it. If you do it right, you don't have to repeat it. There goes your saving. If you keep repeating because you cannot find the right answer and you cannot put the right support, you keep repeating. So if you repeat it 4 times without a good interpreter, and you do it only once because you have a very good trained interpreter, you save 3 sessions in time and money. Anytime a personnel, an agency personnel put service attending to a person, that's money, right? That's money. You're paying that person to serve, right? But it's different serving one person 4 times and serving one person 1 time, because the interpretation is effective. And so the work of the case manager is effective. She will just do it once. She will not repeat it again. And so in the big picture, your performance index is stronger. Your people are motivated because when they start something, it ends up well. Think about doing things with the same person 4 times, all because we have issues with language. That's that's not very motivating to a person. It to a person serving this person, it could be like, what is wrong with me? Or we can say that this person has been coming here and does not understand. It's not their job to understand. It is your job to make them understand. That's why they come to you. Correct?
So
Correct? So
Eva,
let's name.
Eva,
Yeah.
can I throw something in there? So in terms of recommendations for recruiting, so obviously you're saying educating the community is very important, making
Yes,
sure the
very
community
important.
knows the need is there. And I would ask Kelsey too, if she has access or uses a volunteer center, online platform. I can tell you that our approach to recruiting volunteers for the group that our call center is trying to develop, we actually used our online platform to, and much like any call out for volunteers, you answer the who, what, when, where, and why is there a need? And we've had pretty good success in not only recruiting volunteers for kind of an ongoing need in the community, but also we have an upcoming event, a free dental day, that we were also able to recruit a good amount, I think at least like 15 volunteers in volunteer interpreters to help with that day. So if you have access to an online recruiting platform, that has proved successful for us. So I think in addition to educating the community, that's a good next step. And of course, then there was another question about minimum requirements to be an interpreter. So you were mentioning, Eva, being bilingual. Is that really the minimum requirement to actually being a interpreter? Is to say, okay, I'm bilingual, and then the training kind of fills in the gaps from there?
When we say bilingual, if you are volunteer, we are not screening you for your language proficiency. because you're helping and supporting at the very, very basic level. But if you join one of our trainings, especially on the BSI, you've got to prove that you have been tested for language proficiency with at least a score of 80 and above. You cannot interpret if you cannot say the language, right? You just cannot interpret accurately. And the word is accurate if you don't speak the language. So language proficiency, we do it by test. And the program pays for it because we know it all begins with language proficiency. If you are from Virginia, we cover you. We, we don't have so much, but we try to cover you. So just let us know what you need, and hopefully it's still within the available resources we have, and we will share it with you. We are a public service organization, and so it is our job to help communities grow.
I'm going to tag on to Lynn and Eva if you want to jump in on this. I had a direct message from Bonnie that I thought was worth sharing out. She had asked if an organization wants to recruit volunteers to train as interpreters, can they work with a volunteer center? How would we do that? So Lynn or Eva, what are your
Lynn,
thoughts?
would you like to?
Oh, I mean, I think it's like anything else. If you obviously want to be in your center that markets to the area you're trying to recruit. Now, in today's day where a lot of things can be done online and Zoom, it's true. It may be, almost location and logistics isn't as important as it used to be. So, I mean, I know, I'm more than happy to help anyone who's looking for interpreters. It maybe could be posting a virtual interpreter service, so maybe that's something that many many volunteer centers could engage in around. I mean, maybe Alex, this is something we could look at as a state, that if this is something that we feel can help, kind of on a statewide level, then maybe it is something we can collaboratively do to, pull out resources from our own community to create kind of an online volunteer interpreter service. I mean, that's kind of a neat idea. Not something that I had thought of, and would require a good amount of collaboration, but it certainly can be done because there are people in communities that, that have these skills, and it's just a matter of finding them and how they want
Count
to apply
me
them.
in.
Mm-hmm.
Yeah,
Right.
in terms of collaboration, count me in.
Sure. Yeah.
All right, well, we're just past the end of our time here. So to be considerate of everyone, I'm going to go ahead and wrap things up. I want to thank everyone for your questions and your input and really a robust conversation, because that was the goal today, to share information, to get everyone thinking. And I think we can all leave with some new ideas and some next steps. So again, a reminder, if you want to find more information on those free training seminars, go ahead and go to that Eventbrite, which I'll put the link in a follow-up email to everyone to make sure you have that. And again, for any statewide initiatives, there's a lot going on, and sharing your ideas is the most important thing and the most valuable thing we can do. So always be in touch. Feel free to reach out if you have questions to the Virginia Service Commission, to Eva, to anyone, to your local volunteer centers. So thank you for attending, and Jan, Lynn, Eva, if there's anything you want to close out with. If not, then we can let everyone be on their way.
Oh, to me, I will just repeat Lynn's statement. Let's collaborate. We can do better, and we can be stronger together.
All right. Thank you so much, everyone.
Thank
you,
you.
Eva. And
Thank you,
everyone,
everyone.
have a great rest of your day.
Thank you all.